Hi everyone, welcome back to our Bupa Bitesize on demand session. This series is all about filling in the gaps to your all-important dental queries, providing you with the wisdom to help keep your dental care on track. So today I'm joined by Susie Lloyd, who is a practicing dentist at Bupa Dental Care, and today we're going to be discussing all things oral health. So thanks for joining, Susie. So let's get into the first question. Now, I'm sure we all know how important it is to brush our teeth twice a day, but what do you think most people get wrong with regards to taking care of their oral health?
So two things mainly. Firstly, they don't clean in between the teeth, and secondly, they don't brush for long enough. So let's take the first one. Not brushing in between the teeth is a bit of a problem because that's the first place that food, bacteria and plaque start to stagnate. So if you're not cleaning those areas, then you're more likely to get decay or even gingivitis, inflammation of the gums or gum disease in those areas. How I like to explain this to patients is to think of a tooth as a six-sided cube. Now clearly, if it's a lower tooth, then that sixth side of the cube is in the bone, so you don't have to worry about brushing that. But if you only brush with a toothbrush, you're brushing three sides of the teeth really well, outside, inside and the biting surface, but you're not cleaning sides 4 and 5 very well. So to do that, you need to use products like floss or interdental brushes, and that's going to really remove all of the plaque and the bacteria. The second point was about brushing for long enough to really get around the mouth and remove all that plaque and look after the gums well. You need to brush for about 2 minutes. And that's why electric toothbrushes can be really helpful, because the majority of the ones on the market will bleep at certain stages to let you know how you're progressing. So most of them bleep about the 30-second mark, and so that basically says that you've done one quadrant of the mouth. Keep going, and after 2 minutes, you'll have done everything. And the statistics here are a little bit depressing. The recent stats say that about 31% of the UK will floss on a typical day. We'd really like that to be everybody flossing daily, and about 47% of Brits would only brush with a fluoride toothpaste for around 2 minutes. So a little bit of work still to do on that one.
That is really interesting, Susie. You mentioned about people generally being good at cleaning their teeth, but not so good at cleaning in between their teeth and gums. How can this impact our teeth and gums?
So it's the first place really that all that plaque and bacteria would start to build up. And the problem here is that it really irritates the gums. And so the first sign you see is a little bit of bleeding, and that's the body's way of saying to you, get rid of all that plaque and bacteria. I really don't like it. If that continues, then inflammation sets in. And if that carries on for a long period of time, that can become chronic. And then eventually what happens is the gums start to swell up and they move away from the teeth. You get permanent loss of attachment of the gums from the teeth, and that's what we classify as gum disease. Gum disease is an increasingly common condition found around the tissues that are around the teeth, and avoiding getting treatment about that it is a bit of a problem, because it leads to gum recession and eventually tooth loss. And at the moment, it's the leading cause of tooth loss for adults in the UK, so even above things like fractured teeth and decay. Things that make you even more likely to develop gum disease are things like smoking. There's a definite link there. Diabetes, pregnancy, because in pregnancy the gums become much more sort of highly aware of anything that could be seen by the body as foreign, so they mount much more of a reaction to any plaque that's left around. Also, some medications can make your mouth more dry, so the saliva doesn't have a protective effect there, and eating too many sugary foods also is a problem. When you get older, or having a weaker immune system also makes you more susceptible to gum disease. So it's really important to not only keep up an effective home care regime, but also to supplement that with regular professional deep cleans from your hygienist or dentist.
Are dental decay issues hereditary?
So it's a really common misconception that they are, or in fact actually that's not quite true. However, there are aspects of that statement that could be seen as true. So for example, lifestyle habits, including things like eating a very high sugar diet, potentially not cleaning very well, could be passed down from parents to children. It's a gross generalisation, not one that I love to make, but there's definitely a feeling that if parents have a high sugar diet, then it's more likely that the children then may have to. So there's something in that.
And is there a particular toothpaste that can prevent tooth decay?
So what's really important here is that your toothpaste is one that has an active ingredient of fluoride in it. That's essential for preventing tooth decay. And it's a really topical point because there are a lot of different toothpaste out there at the moment that are quite fashionable, for example, charcoal-based toothpaste, but those type don't actually contain fluoride. Fluoride is really important for hardening up the enamel and making the enamel more resistant to acid erosion and then therefore decay. You can check it really easily. I recommend that you do this when you go home tonight. Turn over the tube of toothpaste, and what you're looking for is the words or the number 1,450 followed by ppm and then a capital F. And that tells you that it's got 1,400 parts per million fluoride, and that's the best that you can get over the counter.
Thank you. I will try that. Almost 2 in 5 adults in the UK don't visit a dentist regularly. Why do you think this might be the case?
I think there's probably a whole host of reasons. So I think it potentially, and you know, in this current climate, cost has a lot to do with it. Some may think that there's nothing wrong with their teeth. So a little bit like, you know, you don't go to the doctor unless there's a problem, and they may think that's the case for the dentist as well. Some pretty busy people out there, time's pretty tight. Anxiety about going is another big reason. Embarrassment, if they've left it a little longer than they would have liked, or increasingly they can't get an appointment. So yeah, lots of reasons, unfortunately, which doesn't help.
Thank you. And around 41% of Britons would opt for teeth whitening treatment if they could. But are whiter teeth really healthier teeth?
Not necessarily. So like you know, colours of skin or colours of eyes, people have different colour teeth, but generally it's thought that that white teeth are slightly more aesthetic. It's not a foolproof indicator of good oral health, and increasingly as we age, you do find that your teeth adopt a more yellow colour. So this is because the covering, the hard covering on the outside of the teeth, the enamel, thins as we age, and so the substance underneath, called dentine, shows through a lot more. So unfortunately, happens to us all, as we age, they look a little more yellow. The major thing I think to mention about whitening is you'd only really want to pursue that as a treatment option once you know everything else is really good, so you've got no active disease. If you've got infections, cavities, other health issues, they really need to be addressed before you do things like whitening.
Yeah, and I'm sure we were all told as children how bad sugar is for our teeth, but what actually is the worst thing you can eat or drink for your teeth?
Fizzy drinks for me would have to be my real nemesis, and the kind of thing that I try to steer my patients away from. Not only are they packed with sugar, they're also highly acidic. So if you think back to your childhood, you know, chemistry lessons, even things like Coke Zero are about pH 1.5. So essentially you're bathing your teeth in neat acid, which will speed up that erosion process and also contribute to tooth decay. The other problem is that after you've consumed anything, eating or drinking, with high acidity levels, is that it takes the mouth a little bit of time to start neutralising that acid and get the mouth back to a kind of safe space again. I normally say to people that it takes the saliva about an hour to start buffering and neutralising that acid. So the worst thing you can do is to sip or have sweet things little and often. If you're going to have it, get it over in a wanna, and then don't brush your teeth until at least half an hour afterwards.
No problem. And do you have any advice for people with sensitive teeth?
Absolutely. First thing you could do is to use a sensitive type toothpaste. Brush with it twice a day, and then you can also, a really effective tip is to put a little bit on your finger and then apply it topically to that area, especially before you go to bed. That's really useful. Try and avoid really strongly acidic foods or drinks, and then wait at least an hour after brushing, because otherwise what you can find is that the acid in the diet softens the outside layer of the enamel, and then if you go and brush immediately afterwards, it speeds up that erosion process. Grinding your teeth can also cause a bit of sensitivity, so speak to your dentist about a mouth guard if necessary. But if the pain and the sensitivity continues and starts to more develop into pain, or it isn't resolving, do speak to your dentist about it. There's a number of things that can cause sensitivity, and sometimes if they're not going away, then that's something that really should be investigated.
Thanks so much, Susie. It's been great having you today. We really appreciate your time. Thanks everyone for joining. We hope you found today's session informative.